Hey everybody, welcome back. It's Mishta, and I've got lots of medical madness. Actually, right now I'm chilling with all my dogs. Look, I have Scouty, Savannah, and Rocky's back there all passed out. And I have a bag of laundry, my clean sheets. I'm gonna put those on in a minute, or try to. I'm not sure if I can do it. And my son told me I should try to have him help, but it got late and I forgot to have him help. So, but I have been trying to take it easy. It has been 2 weeks since the mastectomy and all that, and I've gone back for my. I went back for my first appointment, and then I also went back for my second appointment. My first appointment went all good. Everything, we went down there and everything seemed good. So they just left the drains in, and I was gonna deal with it the next time, and I would go down the next time because I went down a couple days early from my appointment because I was having one side swelling up a lot, and it's because some of the fluid was being blocked from going out. So the drains were still working, just there was clots in them and it wasn't coming out enough. So that time when I went down there, I had an ultrasound, and then I also had them take out the drain on the right side, and they kept the drain in on the left side because it's still swollen and is not draining totally properly, which is common. It happens sometimes, and it's really no big deal. They just said keep the drain in, and they kept me on antibiotics. So I'm just not going to be infected or anything. And I've just been walking around with the camisole thing and having my drain bags and sticking out. And when I go out, I just put a shirt over it because this is like the most comfortable way to hang out and not just be either overheated or, just it's hard to get a shirt on and off and all that. So it's a big challenge to deal with all that. So I've just been throwing on a shirt that buttons up when I go out, and no big deal. But I got the bandages off, and I don't know if you can see, but yeah, I got my nipples. I'm really excited. They are two totally different sizes. I don't know if you can tell that, but this one's much bigger than that one, and it's still draining a lot. So, well, not a lot. It's still draining a little, and I've been trying to milk the line like I showed in that one video. I was trying to squeeze out the line, and then it sucks it out more. And I've been trying to do that a few times a day because she said to do it more often, and that was cool. And today, I was really excited. Today, I I wanted to do a video while I still have makeup on because today I went into my work and said hi to everyone and showed them how I was doing, and I even got to say hi to my boss, and it was pretty cool. So everybody's really excited for me to come back, hopefully in a month or so, and it'll be really cool. But I showed them that I still have a drainage bag, so I'm trying to deal with that and figure it out, and hopefully I can get that out next week on the 1st, and hopefully everything will go smooth after that because I can get more of the saline put in and hopefully get them more even. But right now they're still not even at all. This one's sometimes twice as big as this one, so I'm like, ah. But they said that they can always modify how big either one of them is and whatever else. So, and if I think they're too big after I have them for a minute, then they can try to take some out. I said, okay, cool. Well, we'll see how that goes because, yeah. But I'm just trying to be mellow and relax, and it's kind of hard because technically we have been right next to the mandatory evacuation and the fires, so like we've been pretty much ready for to just leave. In fact, there's a helicopter now. I don't know if it's a fire helicopter or if it's a medical one, but either way, we've been dealing with all this for the last couple weeks. Even when I went and did my appointments, we had the whole car filled with all of our stuff, and we took the dogs with us. And my daughter came over and watched the snake and was ready to just get him out of here if anything happened, because we are like, very close to the LNU fire, and it's been pretty scary. So the last few weeks, we've just kept the car packed and had a few things in here like toiletries and whatever that are just ready by a bag and ready to go. It's almost like camping inside, but yeah, we've been just ready to go. As soon as anything happens, we're just got to get in the car with the animals and go. But yeah, it was been challenging. We've had to go up and around the long way to get to UCSF because we live like across from UCSF, and we've had to go up to like where Ukiah is and drive down, and it's freaking crazy because it's an extra hour in the drive. So it makes it a long, long drive, and it's very twisty and turny on the edge of the mountain. So it's a beautiful drive. It is when you can see it, but it's been so smoky and so horrible. And the dogs have been going with us, and I felt bad. Like we couldn't have the windows open. We had the AC on. And I'm usually the kind of person that like lets the windows down, and the dogs kind of have their head out if they want, and just have a good road trip. But no, not with all the smoke. It was horrible. So we just ended up using up more gas and just did that. And you can see my swords missing. That's been in my car because I don't want to have that burn up. And yeah, it's been crazy. It's been a crazy couple weeks, healing from this and just expecting to have to evacuate at any moment. It's been a challenging time. But we're getting through it, and it's been pretty cool. They took the bandages off my nipples and stuff, and I get to just put salve on it so they don't get chapped, but they look healthy, and they are healing well. So no nipple narcosis. So yay, that's a big deal for me because I really wanted to keep my own, because I loved how I was. I didn't do this because I didn't like how I looked. I did this because I told myself when I was 10 years old and watched one of my aunts go through this and die, I said I would never go through that and just not take them off. And then I thought, well, if I take them off and I'm just flat, I don't know if I'll feel as good about myself, because I've already had depression about other things, and I don't want to add that to something that I have to fight depression for. So I thought this would be the best option. And I mean, since I've had two aunts that have had it, and my grandmother on one side, they all had it, and yeah, I figured, I made that promise when I was 10 to myself, and there's no way that I wanted to go through chemo and radiation or either one, or it would just suck. So yeah, I took care of it, and I chose the one I wanted to choose, and then that way I can feel good and be cancer free, and yeah, it's pretty awesome. And the doctor told me, the surgeon that did the mastectomy, he said it's really good that I had under the muscle, because now, well, when it's all being done, it's under the muscle. So I'll be feeling the muscle if I go and check for lumps, and if I feel any lumps, which is like a really low percent, like 1 or 2%, that could happen. But he said if I ever feel any lumps, I'll know right away and to call him. And so I think that's pretty freaking awesome. So I'm glad I chose under the muscle, and I'm glad that it will be super easy to deal with. And I still haven't had a whole lot of pain. After my first shower, I had a little bit of pain, and it was way up here, but it was because my left side swelled up so big. And it was crazy. It was like when I was having my kids, and they got swollen up, and I couldn't breastfeed, so I had to just let them deal. But they were huge. And my best friend was like, hey, it's the first time we've had boobs ever. And so it was kind of funny. But one of them swelled up like that, and the right one did not. The right one was just being normal and draining and stuff, and it was pretty crazy. So I was a little bit worried, and then that's when I called, and they said, come down and have an ultrasound. And everybody down there is so awesome. They really, really are. They love the fact that I have a channel about being HIV positive, and that I share these videos with you guys. In fact, I tried to go and share like the ultrasound and all that, but they said I wasn't allowed to share in there, and I was like, okay, no worries. And so I didn't do that out of respect. and the other one where they're taking off all the bandages. I mean, I figured YouTube isn't going to let me keep that on, so I didn't. And so this is what you get. It's a camisole. It's all good, yeah. But yeah, I keep it loose because I don't want it to be tight around this the drain over here. And it looks pretty cool. I mean, I don't remember if I showed you guys, but it looks pretty cool. So I can do it without showing everything else. But yeah, it's got a big drain like that, so it looks pretty cool. I love gross stuff. But there's my bloody bag, and there's the port that it goes in through. And this thing goes up in and wraps around the whole spacer. And it goes above and below, I think. And it gets all of any infection and blood and whatever out. So, yeah, that's what I'm dealing with still. But yeah, it's pretty cool. I didn't get to show you guys that before, I don't think. I don't know. Maybe I did. But I didn't feel like it was good to do a video of just the bandages because my daughter said it would probably be taken off, and I didn't want my whole channel to get taken off or anything like that, even though not that many people watch it. So, I mean, but I guess YouTube people watch it and they have the rules, so wouldn't want to be breaking any rules. But I figured I would try to show you that because that's kind of trippy. I thought it was kind of cool that I had one on each side, and now I get to take the bandage off. I should have actually took it off today, but it didn't come off. So when I was in the shower, so I went, okay, I'm just gonna leave it on until tomorrow. It was a tiring shower because I haven't been able to put my arms up at all. I've been having to just keep them like this or by my sides, and because they don't want you to move up and lift things or anything like that. So I've just been resting, and if I do my phone video chats, it's like this, and I'm trying not to reach for things. I'm trying not to lift anything, and yeah, trying to just do all the right things and be healthy. So I did want to share a little bit with you guys tonight. While I looked fairly decent. I mean, I don't look too bad for having surgery 2 weeks ago. But I did put makeup on today, though, because I wanted to go see the girls at work and look nice and show them how good I was doing. I didn't want them to feel good about it. And, yeah, because I love my girls and my family, and I miss them so much. I really do. I really miss them. So, but, yeah. And, hey, I think my hair came out pretty good still. Even after we did it right before I did the surgery. So, it's coming out pretty good. I like it. Yay, Arctic Fox. Okay, so I just got sidetracked. Sorry, ADHD. And it's like 11:30. But I wanted to do a video while I at least look decent and then just look, no makeup, no nothing. And yeah, I mean, I put it on for the day. Why not do a video? Take advantage of the time with my makeup on. But yeah, I got my Fenty eyeliner. And again, it's my favorite eyeliner. It's her fly pencil. They go on so smooth, and they go where you want. They stay, and there's nothing else I can say except they're perfect. And I love them. And this one's a really cool blue color. I don't even know if you can tell it's a blue color. You can. No, you can't. But it's an awesome color, and I love it. But anyways, totally off topic again, because my ADHD, and it's 11. But anyways, I'm getting all goofy now. I better go to bed and get some rest. I think I kind of overdid it today. I did a lot. I did my own shower, and that's kind of a lot, just having your arms up, washing your hair, and then I did a little bit of shopping with my son. He did all the things. He did the cart, he did the reaching, he did the lifting, he did everything, and all I did was stand there and point and walk, and they said I'm allowed to walk. So, but I did that, and then I came home, and I was trying to do a little bit of laundry, which was not heavy. I just did little tiny loads, and I think I just did a little too much, so I'm kind of worn out. But yeah, it's been a long couple weeks, but it's actually gone really quick at the same time. It's weird. So I'm really doing well though, and I'm really, even with the extra large left side, it's still doing good. And I'm gonna keep this thing in and keep draining it like they said, and that's all you can do. And they said to keep massaging it to try to push it out, and so she showed me how to do that. And it's really just like you would do a self breast exam almost. And it's like when you do a self breast exam, and that's really about it. And then you kind of milk it out of the thing. I know it sounds gross, but it's worth it to not get infected. But so far, overall, just totally healthy and doing good. So, yeah. And this video is getting really long, and I better go to bed. So, I hope y'all have a wonderful night, and thank you for watching. And please like, comment, and subscribe, and ring the bell for notifications. Definitely have a peaceful night.